think it's working now. I can't hear anybody. I think we're a little bit short today.
Oh.
We it's just a few of us today because everybody's out for one reason or another. But we're going to give it a couple more minutes, and then we're going to do a short update for the community regarding COVID and some of the updates with Health and Human Services. Hopefully, get more people to join, but it's not necessary. They can watch it later. Okay. We have Lenora on, we have LaDawn on, and you have myself. Rebecca, she's out. She's out sick, and so is Claudia. It's not COVID, just in case anyone's wondering. And Thelma is out at a training in Albuquerque, and Raylene and Darylyn are out doing visits, so they are not available either. So it'll just be us, and updates should be pretty quick. There's not a lot to what we have to report. I know some folks have been some folks have heard the blasts or have seen the updates on social media regarding the new cases. Since yesterday, we've actually gotten another new case. So the numbers are still rising, but additionally, there are some that are still, they're recovering and coming out of isolation. So as we get some to come out of isolation, we're still getting some positive tests as they come through. So today is June 9th, 2022, 11:15 a.m. We'll go ahead and get started. My name is Troy. I'm the Department of Health and Human Services Director and the team lead for the COVID response team. And we have LaDawn Yazzie, who is our tribal public health educator. And we have Lenora Arieta, who is our ICWA manager slash family advocate. She's only, one week in, Lenora, or how many weeks in are you?
I believe it's 1 week, starting my second week.
But you are a returning employee in the same position from 4 years ago you were in that position?
Yeah, approximately 4 years ago.
Okay. So that it's going to make it a good, easy transition because she is familiar with the Pueblo Tribal Administration and with the program. So hopefully we can get some new and exciting things started. Sorry, my audio is going through my computer instead of through where it's supposed to. Let's see if that works better. Okay. So with that being said, we have the update for today. Currently, we have 9 active cases. We had 1 person come out of isolation as of yesterday. That brings us to a total of 237 cases since the beginning of the pandemic within the confines of the village, and with 226 having recovered. So a lot of what we need to make sure we make clear is that there is a lot, the cases that we're getting are no longer case infections that are coming from outside the Pueblo. We have active community spread, which means the people that are getting infected in the community are getting infected from other people in the community. So that's why we wanted to make sure we push the COVID safe practices as we were previously when we had had outbreaks, which includes if you are around people, especially those who are vulnerable adults or elders, make sure you wear your mask so that you do not transfer the virus to folks who are not easily able to recover from this virus. Um, and also to keep those who are immunocompromised safe from the virus as it continues to spread. Currently, we have positive individuals that are extremely young and some that are also older. So it is affecting just about every member of the every age range in the community, as well as vaccinated and unvaccinated people. And I just wanted to remind people that as the vaccine is not or was originally designed to try to keep folks from getting symptomatic COVID, but it wasn't designed to stop people from getting COVID at all. It was designed to keep people from getting extremely ill, hospitalized, or worst case scenario, dying from the virus. So this new Omicron variant, talk about which one it is here in just a second, is the driving force behind the spread that we have that's been going on recently. So these are the numbers as of yesterday for the state of New Mexico. Um, we have 140 current hospitalized persons in New Mexico from COVID, 9 that are on ventilators, uh, 13 new deaths, 1,100 new cases as of yesterday, and the testing is continuing. These numbers are extremely low with regard to the number of cases that are being reported because of the home tests and people not reporting home tests. The cases that you see are only those who are actually getting their testing reported to the state of New Mexico and documenting the number of cases that there are. So they're estimating that that could be potentially double that number of active cases right now. But again, as we have talked about in the past, the most serious part of COVID and how we are navigating it, it should be reflected in the number of people that are hospitalized and number of deaths, and not necessarily the total number of cases, because people will get COVID. And with the types of treatments that we have and the high level of vaccination rates that we have in the state of New Mexico, people are not getting as ill and they are not being hospitalized at the rates that they were at this time last year. Um, just so you can see the positivity rate over the last couple of months, it definitely increased between the beginning of May and towards the end of May, and it kind of plateaued right around the first part of April, or sorry, of June. And as you can see now, it is actually starting to go down, and this is the positivity rate for the state of New Mexico. So yes, we have had a spike and we've had increases in uh, cases, but it seems like they are leveling out. I think we as a community are just now getting affected significantly by these positives that are going on, because during those time frames when it was spiking, we weren't having cases. But I think now that it has reached the boundaries of the community, we need to start looking at it as though we were just like the rest of the state and having a spike and being as careful as possible. Um, the community transmission rates, this is probably a little small for you all to read, but we're looking at the number of the counties with the highest levels of community transmission. And if you look right here where the cursor is on the screen, you should see Santa Fe County has the fourth highest community transmission rate between May 24th and June 6th, which is pretty significant. I know that yesterday in the Department of Health's first media day where did their COVID update. There was a lot of good news that was put out regarding COVID, and regardless of what the spike looks like right now. And I agree that it is good news for the entire state um, overall, but we also have to look at where we are as a community, as well as the county that the community lies in, and the amount of cases that are showing up at this time. There's a lot of talk about the variants that are causing the spread of COVID. And if you look, this is going back to July of 2021, where, as you can see, all the green was the Delta, which is what drove a lot of the high hospitalizations and high death rates in the state. But as you can see, when we got into the end of 2021 and the first part of 2022, Omicron took over, and the spikes were significant. Of course, the hospitalizations weren't as high. The death rate was not as high. But if you look at where we are now, all the way down towards the end of this, so the BA 1.1.529 was the original strain of COVID or of Omicron. And now we are affected by BA2, specifically BA 2.12.1, which is what's driving the spike in the state of New Mexico and across the country. But as you can see, you know, that strain has basically been the dominant strain since the middle of April, going in through May and now into to June. That is what we are looking at as the dominant strain of COVID in the state of New Mexico, which is considerably more contagious and infectious than the original strain, which was the Alpha strain. And so the Omicron strain was somewhere between 40 and 60% more contagious than the original strain. And the new BA2 strain of Omicron is actually considered 30 to 40% more infectious than that strain. So if you think about it, from the time of the beginning of the pandemic to now, the level of infectious rate or transmissibility rate is much greater than the original strain. But what's good about now, in comparison to back then we didn't have vaccines. Back then we didn't have really good specific treatments for COVID, and now we do. So yes, we're concerned about COVID cases. Yes, we're concerned about community spread. Yes, we're concerned about people getting sick, but we also have to look at the fact that we have treatments for it, and there's a lot higher immunity in the community from either past infection or from vaccinations in the community. And I wanted to remind folks that with the vaccination rates, we are looking at the level of vaccination based on the original primary series, which was the first and second dose. The first and second dose is great to have, but as we know, the immunity level starts to drop, between 4 and 6 months after the last shot that you got. So if you have not gotten your booster, the reality is that your likelihood of becoming sick is greater as that immunity wanes. Some of the folks that have come to us to talk to us about getting their boosters, they got their last shot back in October and November of last year, which is when the big boost and big push for vaccinations took place. And that immunity has basically dropped since that happened. So if you got your last vaccination and at the end of 2021, you're due for your booster if you're eligible. So my recommendation, of course, and the recommendation of all the public health folks, is to go get your next booster shot if you're eligible. Currently, the 50 and up and immunocompromised are eligible for the fourth shot, and they just recently approved booster shots for the 5 to 11. So basically, there's the ability to get a booster shot for the vaccine for those ages 5 and up, if you have only the primary series of a vaccine. So that is basically the extent of the update regarding COVID. Um, we are having an outbreak within the community. It is traveling pretty quickly through families and associates of families that are positive. So just be aware. We are still available here to assist you. We do have masks that we can give out. We do have testing that we can do. We have home tests that we can actually distribute to you all if you don't have any more. There's a lot of miscommunication out there around the effectiveness of the home tests. And I think someone mentioned that they were told that the home tests were only 30% effective, which is not true. The problem with the tests is that individuals who are testing for COVID. They are it's what we're referring to as operator error. And what we mean by operator error is that people are testing a lot earlier after exposure than they're supposed to. And just as a reminder to the community, we're only supposed to test after exposure at least the 5th day after you were exposed to someone who tests positive for COVID. If you test any earlier than that, it is very likely that you will not pick up any virus because you're not infectious yet. You don't have enough virus in your nasal passages in order to pick up any kind of virus. So make sure you're paying attention to the date that you were exposed. Don't be too quick and too much in a hurry to to test yourself, because if you test yourself too early, you'll have a false sense of security, thinking that you're not positive. And the incubation period for this virus is on average 5 days. So if you are exposed to someone who tests positive and you are not symptomatic, do not test before day 5. That's the first operator error that is being identified with some of the folks who are saying that these tests are not accurate. The other operator error is the distance, or how far you go into the nasal passage to collect a sample. I know that some of us who were getting tested way early on in the pandemic remember when they were sticking that thing all the way up into your nasal passage where it felt like it was touching your brain. You don't have to go that far, but 1.5 to 2 inches into the nostril, if you're an adult, is basically is the distance that you have to go in. If you just go just inside the nostril, inside the nasal passage, you're not going to get virus on the swab in order to test it correctly. Additionally, people think, well, if I just put it in my nose is running, if I just put it in the discharge from the nostril just at the beginning, that should get it. Well, it could, but just remember that the body's defense mechanism against viruses is to cough to get it out of your lungs and your respiratory system, nose to run to get virus out of your nasal passages, fever increasing to kill the virus inside of your body. All those things are mechanisms for the body to get rid of or fight a virus. But you may not have virus coming out in the nasal discharge. So just getting the discharge in your nose with the swab may not collect or capture enough virus for the test to pick it up. So you have to actually go a little bit further to the point where you feel like you're going to sneeze, which is the common response for people when they know you've gone far enough. You're probably going to feel like you're going to sneeze. So that's where you want to go. So if you don't go that far into your nostrils, there's a possibility you will not pick up enough virus, especially if it's in the early stage of infection. Your viral load is low. There's not that much viral virus in the nasal passage, so you're not picking it up. So do not immediately assume that some of the reports that you're hearing about the home tests are correct. They are pretty effective, somewhere around 85% effective, as long as you're testing at the right time that the virus has replicated in your system and it's showing in your nostrils. Um, that's one of the reasons why we recommend that you come over to the HHS department and let one of the COVID response team do your test, because we know exactly where that sample needs to be collected from, and we actually have test systems over here that are a little more sensitive than those home test kits that you have there, and we can do both nasal testing, and we can also do saliva testing for PCR if you are not really comfortable with the nasal test, except that the saliva PCR is going to take a couple of days to get the results back. Just like as if you went to BTR, Buffalo Thunder, or if you went to Northern at the college, or you went to the hospital and got tested. It takes a couple of days or 24 to 36 hours, really, once they receive the sample to get your test results back. So, Jeannie, the answer to your question is we actually have a lot of tests in our office to give out. In fact, Victoria was going around the community today and was delivering test kits, but it was really to the administrative departments so that the employees are getting tested regularly to make sure that they are not positive and potentially infecting each other as well as members of the community that they're serving. So now have been delivered masks when asked for, and test kits so that they can test themselves. If you all need test kits, let us know. If you don't want to come out because you're either sick, having symptoms, or you just need someone to assist, our CHRs and our members of our department can deliver some tests to you so that you can have tests to test yourself and your family. Remember, there's two tests in the test kit boxes. How it's designed is if you're exposed to COVID, you take your test at that 5-day mark. If if you test negative, you take the second one that's in that box and you test yourself 2 days later, just to make sure. Because that's what I think people are also missing. They're doing that day 5 test. And remember, I said earlier, on average, the virus is detectable. The virus is detectable, at day 5. Sometimes earlier, but most times is at day 5, and sometimes a couple of days later. And also as an update, this new variant, this BA12, they are now identifying that it is staying active in our bodies for 7 to 12 days on average, in comparison to the previous Omicron variant, which was 3 to 5 days, which was what drove the CDC to do their 5-day isolation recommendation. Just so you know, that the majority of the people who are using the executive order and trying to test out after 5 days so they can come out of isolation, the majority of them, I would say probably 75 to 80% of them, are still testing positive on day 5. So the virus, this subvariant of Omicron is different. Yes, it does not getting people as sick. For those who have the ability to fight it off, or are vaccinated, or have prior infection, they are recovering pretty quickly. But we also need to make sure we pay attention to the fact that there are several members in the community that are immunocompromised and should not take the risk of getting infected. And we have people who are over the age of 65 who are at the highest risk of poor outcomes from COVID, who may have a challenge fighting off this virus. So that 7 to 12 days of infection is an important number to remember. because if you are trying to follow the CDC guidelines, which you shouldn't be if you live in the community because the executive order is 10 days, the isolation period is important. Um, Trying to go with what was presented previously in the last outbreak, trying to only isolate for 5 days is not a safe thing to do for yourself, your family, or the community. So my recommendation is get a test kit, get as many test kits as you can, and make sure you're testing yourself at day 5 if you don't want to come down to our office to get tested, and then again at day 7 to see where you are, to make sure that you're still not infectious and able to spread the virus to others. So, um, Jeannie, the boxes and that previous batch that we gave out at the community health assessment, they do expire on June 27th. We have others here at the office that expire in July. So we can definitely provide you tests that you can test with at least until the end of the month, and some going into July. So we're trying to get out the June test kits, the ones with the June expiration date, now as much as possible. If you are interested, please contact us. Call the COVID line 505-252-5986, or call one of the CHRs. Um, if you have someone who um, cannot make it to our office to pick it up and you'd like to collect test kits for them, just call us and let us know, and we will get them to you so that you can make sure that people are safe. We're not trying to force this on anyone. We're just recommending, as we start having community spread, that people are paying attention to the fact that this virus is extremely contagious, and sometimes even without symptoms, you can be infectious and be passing the virus around to other people. So having known exposure is enough to justify testing at day 5, and just to make sure that you and your family and the community stay as safe as possible. We went from having 0 cases to having quite a few cases. I think that if those 5 people over the last several days did not come out of isolation, we would have 14 active cases right now. So some folks did get a chance to test out at either 5 days or a little bit after, and they came out of isolation. But remember what the executive order said with regard to the reopening plan. If we get to the point where we have 10 active cases that stay at an average of 10 cases over a 21-day period, there is a risk that we will have to reconsider the reopening phase that we are in. That is not a guarantee, but that's how the phase reopening has been written. So we're trying to do whatever we can to prevent the spread of COVID, so that we can continue forward as a community to rebuild and stay safe post COVID, and do what we have to do so that the community can engage in traditional activities safely, and continue as possible, socializing and rebuilding people's connection, since we had the 2 years of lockdown and restrictions and things like that. So whatever we can do to keep the community moving forward, that's what we'd like to do. So thank you, Jeannie, for the questions. If anybody else has any questions, thank you for those who have joined us live for this update. And if there are no more questions about COVID, we're going to transition into the Human Health and Human Services update, if anybody has anything. You have anything, LaDon?
I do. Are we good? Okay. So, moving on to other information, I wanted to share a few things that are taking place here at the Health and Human Services. So, in light of National Safety Awareness Month, We are going to bring in a special guest, Jerry Folgate, next week on Tuesday at 1 p.m. So we're going to have a fire safety and readiness podcast. So I just wanted to invite everybody to participate here once again. We'll be live and we'll have Jerry in-house to talk about different ways of mitigating fire hazards. And so that's one conversation we'll have next Tuesday. And then on Thursday, we're going to have a master gardener come in. Actually, we have him as an invited guest. His name is Artie Ozzie, and he'll be joining us as well for a podcast. Earlier in the month, or earlier last in May, we, myself and Victoria, the Healthy Kids, Healthy Community Coordinator, were able to work with Sembrando Salud, and we were able to distribute garden kits. So that was successful. We had a few participants who were able to gather garden kits, which included organic soil, and then also tubing to start a water line, and then also about 10 packets of seeds with instructions on how to get things started. And so we wanted to be able to try to get community members to start a small garden. So really starting, in their home, with this kit. And so we have Artie, who's going to provide a little background on how to get those seeds started if you haven't already done so. And so we also have a few more kits available, and maybe Victoria would like to share a little bit on maybe we have a few more kits, correct? Yes. So you would, if you wanted to reach out, Victoria's available, and she has a few of those kits. They're available at no cost. We just want to make sure that you're moving in a healthy direction, or taking considering lifestyle changes that will help you understand your health and the importance of maintaining your health. And I think that's all I have from my department. Let's see.
Oops, I was muted. Your mic was still on. Nice. Victoria, do you have anything else that you want to update folks on?
Let's see. No. LaDon, like LaDon said, we have some of the garden kits available. So if anybody's interested, call us, let us know, and we can deliver. Let's see what else. We're still conducting fitness assessments. So if anybody's interested, call us ahead of time, and that way we can schedule your time. I'm very flexible with, whatever you guys may need to come in after hours, as long as you show up. What else? I think that's about it. I can't remember anything else. But if you guys need anything, let us know. We're here.
Thank you, Victoria. I know that the other day when we had our community health assessment event, There were a lot of questions about when there's going to be another opportunity for individuals um, to participate and provide their input from the survey. And I just wanted to let everyone know that we will have next week, there's going to be a couple of more options to participate. The Albuquerque area Southwest Epidemiology Center, Aztec, Tribal Epidemiology Center, Aztec, their staff will be hosting the next three events. They will, the location at this point has not been determined. We are still trying to make sure that we get the appropriate permissions from the administration around which building that we're going to be able to use. We're not sure if we're going to continue on with the senior center or if we're going to try to use another location in order to provide that. But the dates are pretty set. So on June 13th and June 14th, there's going to be an in-person opportunity between 3 p.m. and 6 p.m. to do the actual survey for community members. So if you want to put that on your calendar so that you know that that's coming, that's those are 2 days that you'll have to do it. Aztec, again, like I said, Aztec will be the ones having that event, and we may have some of our folks there as well, but Aztec will be the primaries on that as we are getting back to doing some of the things that we're supposed to be doing for our regular jobs. But also on the 15th of June between 9 a.m. and 6 p.m., they're going to be there all day, giving the community one last opportunity to engage in and participate in the survey. And then after that opportunity, that last in-person opportunity is done, we are actually going to, whoever's left, we don't know who received, who completed the assessments, who did it, because on our side, all we have is a unique identifier that we can refer back to. But Aztec has all the information about those individuals who have and have not completed the survey. And so what will happen is those individuals who are identified as not having been able to complete the survey, they will have one mailed to them, which is a good opportunity because, there are some folks who can't make it in person. So we would like to give people an opportunity to do it on paper and have a unique identifier assigned to them. It'll actually be on the document when you receive it. And then when you turn it in, Aztec will also arrange to make sure that your gift card is sent to you. So that I wanted to give that update. We would like to have the surveys all received by the end of June, if possible. If not, by the first week of July, so that we can start collecting the data and start trying to determine what the needs and concerns that the community has, so that we can start steering our grant writing and our provisions of services for the Department of Health and Human Services to appropriately serve the community based on what you all actually want and need, not on what we assume you want and need. That's what this survey and the whole community health assessment process is about, is giving you all an opportunity to tell us what you would like to have us do to help you. I wanted to announce, as you can see on the screen, in partnership with DCEP, HHS was able to purchase and have designed a community-specific sharps disposal container for the community to use. So there were a lot of reports from um, the transfer station that individuals who are living with diabetes and they're insulin dependent, having to use either the needles, the syringes to give themselves insulin, or the auto injectors to give themselves insulin. They were being dropped off in the regular trash, and of course that creates a hazard for the staff that work at the transfer station. So what we decided to do was purchase a sharps disposal container that's basically, as you can see on the screen, this kind of looks like a mailbox. And what it's designed to do is, if you or someone that you know in the community have a need to dispose of uh, syringes or anything else that's sharp, whether it's an EpiPen or it's a regular needle, or when you all are out, you all that are living with diabetes, that you have to check your blood glucose and you have to prick your finger. Those little things have needles on them, so those lancets are also considered hazards. And so, if you are in any way needing to use needles for any reason, syringes for any reason, the lancets, auto injectors for like insulin, or for EpiPens, do the transfer station staff a favor, put it in a small box, or however you generally collect your needles and your items, and you take them down to the transfer station and you drop them in that box, and you don't have to do anything with it. The transfer station staff don't have to touch them or try to find ways to store them. A lot of people put them in their little the Folgers cans, or they're given. We also here at HHS, we actually have a little small black sharps containers that we of this box down are safe. So that is a service that is being provided to the community, of course, free of charge, without any kind of questions asked or anything like that. Just come down and drop your items there instead of putting them in your trash and leaving it to the transfer station staff to find ways to dispose of them. Additionally, the Health and Human Services Department, I think it was the beginning of April, we announced that we have the ability to collect both expired and unwanted medications, whether it's a prescription medication or an over-the-counter medication. If you go through your medicine cabinet or your drawers or your medicine bags or wherever you keep your medicine, you have medication that you do not know what to do with it. Instead of, like some folks do, flushing it down the toilet or putting it in the trash can, we are asking that you deliver those items to the Health and Human Services building. And we actually have a container that we put the medications in, so that we can ship it to a location to destroy, so that we don't have those pills floating around anywhere or staying in your house where they should not have to be, especially if they are controlled substances like opioids or benzodiazepines, things that a lot of the young people these days are taking and using illegally for whatever reason. We would like to do whatever we can to get rid of those medications and keep them out of the community, so that there aren't any issues with people using medications that they are not prescribed. So just wanted to put those two updates out there. Also, we have to make sure that everyone knows that on Tuesdays and Thursdays of every week at 8:15 in the morning, we are continuing to have our health and wellness walks. All community members are invited There is no specific requirement to, how fast you have to walk or how long you have to walk, or, if you have to keep up with anyone. If you would like to just walk for your physical health or walk for your mental health, we have staff that are going to be there every Tuesday and Thursday morning at 8:15 to walk with you. If you just need someone to talk to you while you're walking, that's what they're there for also. So, and you also might get Victoria trying to convince you to come and do a fitness assessment, but that's a whole nother story. Um, she, um, but I think anything else? Do we have any other events that are coming up, guys? That I forgot about. I forgot to look at the calendar before I came in here.
You mentioned the men's health presentation.
Oh, yes, that's right. What day is that? The 21st?
22nd
The
at
22nd.
5:30.
So June 22nd, just another reminder. I know we talked about this last week. It is National Men's Health Month. And just like last month, we did the National Women's Health Month, and we did a lunch and provided some health education topics. And we also did a walk for the ladies that showed up. But I also provide a presentation on mental health awareness, those topics that people generally don't want to talk about, or they're just not quite, um, informed on. We want to make sure that the community is quite aware. And we're this month, it's the men's turn. So if you're age 12 and older and you'd like to participate in this event, it is going to be available to everyone June 22nd, starting at 5:30 p.m. So if you have any questions about that, you can contact Thelma with the CHR program, and she can give you more information about that. Keep looking out for the flyer for that. I believe it was put in the bulletin, but there are some questions about the availability because it is potentially in conflict with another activity. So there may be a need to change the date, but as of right now, it's scheduled for June 22nd at 5:30 p.m.
Do we have anything to do with the car seat clinic?
Excuse me?
Do we have anything with the
Oh,
car seat clinic?
That's right. We do have so we were invited to have a booth at the car seat clinic. So the Aztec, I always get I have to say the acronym out loud because it's always difficult to remember it. It's the Albuquerque Area Southwest Tribal Epidemiology Center. Aztec is having a car seat safety clinic this Saturday, June 11th. What are the times again?
8 to 12.
Between 8 a.m. and 12 p.m. There is a requirement to make an appointment, but I was also just notified by Alex that they are also having a vaccine clinic at the same time being provided by Presbyterian Hospital. They're going to be there during that same time frame providing COVID vaccines for anyone who is in need. So this Saturday, if you have young people that live in your house that need the services or the car seats, they are having a car seat clinic there. There are going to be other social services agencies there present from other communities, other pueblos, other service providers. So if you just want to get out and mingle amongst, some of our fellow Pueblo nations around here to just kind of get an idea of what they do for their service and their provider services. You can also show up for that reason, but its primary purpose is the car seat clinic and now the vaccination clinic this Saturday between 8 and 11 at the Pole Cultural Center. So if you have any questions about that, you can contact Alex Luarkey. What is her phone number on there?
505.
Oops. Sorry, I'm typing this in the private chat and not in the regular chat.
505-506-5231.
505-506. What are the last?
5231.
5231. So that is for the CARSI clinic and the COVID-19 vaccination clinic. Seat. Clinic. Here it is. All right, so that's in the chat. Oh, I didn't put the date. Saturday,
11.
June 11th at
8 to 12.
8 to 11. I don't know why I said that. All right, so anything else for update before we sign off? Lenora, you have anything?
Not right at this moment, but if anybody needs to come by and see me, if they need resources or anything, my door's always open. I'm available. Give me a call.
So everything that ICWA was doing previously, were family advocacy, there were diapers for the young ones, you know, assistance with services to get referred to or connected to substance use services or mental health services, all those things that a family advocate generally does. Lenora is definitely a person to contact. We are planning on working towards providing the Circle of Security parenting training through her program to the community in the near future, as well as mental health first aid and QPR, suicide prevention trainings, which I'll be presenting because I'm certified to provide those trainings as well. But we're going to try to start expanding services that are going to help people as they start coming out of COVID and are dealing with the stressors of reintegrating back into the world differently than we have had to be over the last 2 years. So some of these things are going to become part of how we help people move forward. So it is 12:05. If we don't have any more input from the team or there are no more questions from the community, we are going to disconnect and we will invite you to join us on Tuesday at 1 p.m., June 14th, for the National Safety Month presentation. And also next Thursday, I think we will have Rebecca leading the COVID update because I will be out of the office on leave. So, but there will be an update next week, also on Thursday at 11. So join us then. But without any other questions, on behalf of the Department of Health and Human Services, we are signing off and see you next week.